This is a Defocus Media production.
Audio Jungle.
What's up, everyone? It's your favorite optometrist, Dr. Daryl Glover.
And I'm Dr. Jennifer Lyerly, resident optometry nerd.
And welcome to Defocus Media, optometry's #1 podcast, where we discuss the hottest topics, latest technology, eyewear, practice management, and more. So sit back, relax, and defocus.
Hello and good morning, everybody.
Hi.
Welcome to the Focus Media Podcast. I'm Dr. Jen Lyerly, and I'm here with Diana Dwyer of House of Glam Studios. And we're really excited for this conversation because our two worlds actually have so much in common, and we share many of the same patients, clients, customers, but we don't often get a chance to interact and how we can best assist our patients as optometrists. I see all the time my patients coming in talking to me about their eyelash wants and needs. And I think traditionally, aesthetics is not a part of our optometric training. Yep. Most optometrists are easily dismissive of procedures because we'll sometimes see horrible cases of patients coming in where they've had this big allergic reaction or terrible blepharitis. And so we tell our patients, oh, that's a really bad idea. These are not good procedures for you. But at the end of the day,
you're on the side of caution too.
Yeah. Our patients do really want these procedures, and taking that kind of strong negative approach is actually very negatively impactful to your patient relationship. And so we want to bring someone who's an expert on these procedures so that we can better educate ourselves as optometrists on what our patients are wanting and what they're actually getting when they go see an esthetician. So Diana, welcome to the show.
Thank you. I'm so excited to be here, Jen. Thanks for having me.
Can you share a little bit about your background in House of Glam Studios?
Yeah, absolutely. So I'm co-owner of House of Glam Studios, and we train people from all over the world in eyelash extensions, brow lamination, and spray tan, with eyelash extensions and lash lift procedures being our #1. So this is something that both my business partner and I are extremely passionate about. I never knew that I was going to go into anything in aesthetics at all. I wanted to go back to university and get my undergrad in public health. And the reason why I ended up getting into it was because I knew that at that point, being a single mom at that time would be financially stressful. So I took a course in lash extensions. And when I took that course stayed with me for my whole life. It stayed with me because I seen so many errors in those training programs, and I wanted to create a better training program for people. So that's essentially how I got into lashes, and I'm so happy to be here. And right now I'm studying my cosmetic science master's program at the University of Cincinnati, and I'm just kind of working through those semesters. But it's fun because I get to take all of the education and experience that I have with eyelashes and now apply it to my master's program, because this area itself doesn't really have a whole lot of scientific research in it. So
that is absolutely incredible. And I did not know that was a master's program option, but it just shows how little we're aware of how much great training goes into this profession of aesthetics.
Yes, absolutely.
So you've got obviously a worldwide brand. Tell us a little bit about House of Glam Studios and how, that training program, where was the need that you felt like, oh, this is something we could provide?
Yeah, so I guess both Christy and I, who is my business partner, we were both running our own separate businesses doing lash extensions for a while. And we noticed that there were a ton of people being trained the same way that we were. So for instance, when I took my course 10 years ago, one of the first courses here in the province of Newfoundland, I went there for the day, and the training, I really felt like I wasn't comfortable and confident in myself going out there. And I was a little bit nervous. I think I applied 10 lashes. I think somebody got somebody's eyes glued shut. And at the end of that day, everybody walked out of there with a certificate. And I was like, this is weird. And then as things progressed, I was like, I am so passionate about the lash industry and cosmetics, and I don't want it to have this negative reputation. So then it starts with the trainers and the training that they're receiving. You can't put it on the industry itself. It's those companies and those individual trainers, they need to have the education behind them to teach other people. And they just needed more programs that would be beneficial to students and actually setting them up for success. So I went through and I created all of our programs. And I didn't go on like random Google websites. I went through all of our articles and journals online on PubMed, on different places. And I made sure that the information that I was putting into that program was accurate and science-backed. So I wanted to have a program that was, and multiple programs that were different from the majority of programs on the market with like, hey, purchase this course online for $200. Truly wanted to give everybody a higher level of education. And that's where we are with it now. And it's, you know, it's only been 3 years that we've had our business, House of Glam, and we're doing really well with it. And we get people calling us from like California, from different places, being like, oh, I've heard so many great things about your program. Like, I'm going to enroll in a course. And it's really, really nice to know that like all this work is paying off.
That's fantastic.
Yeah.
Well, I want to pick your brain about what are the most popular aesthetic procedures right now, because I definitely feel like we're in an eyelash phase, but there's a lot of different things that people can get to enhance their eyelashes.
Yeah. So essentially, like you have eyelash extensions, which is one thing. And then you have your lash lifts and tints. There's a difference between classic. And I don't know, Jen, have you ever had your lashes done?
I've not done anything.
I feel like every optometrist,
we know nothing. So you got to teach us.
You're like, I am not doing that. Out. Not happening. So funny. Because any of my friends who are optometrists as well, I'm like, have you had yours done? They're like, not doing it. Not going there. But yeah, so essentially what happens, if you want me to kind of explain to you what's happening during the process. So you're taking this fiber, this thin little fiber, it's PBT, I think it's polybutylene triathlate. It's really just a plastic, and that's what lashes are made out of. So you're taking that and you're placing it directly on your one lash. So you're isolating that lash, taking adhesive, and the adhesive is being put onto your natural lash during isolation. Now, errors exist when people are using thicker diameters, because my rule of thumb is always you should never apply a lash extension that's thicker than the person's natural lash. It should be thinner. So that's what's happening there. You're applying it and then you're curing it as well. So the adhesive itself is a cyanoacrylate based adhesive, like many adhesives. Common misconceptions, people think that formaldehyde is an ingredient in it. It isn't. Formaldehyde is a byproduct, which is something that we need to be aware of as well, because if that's going to be irritating your eyes, and there's ways to control that. But yeah, so classic and volume lashes, really popular. Mega volume lashes are extremely popular. And those are the ones that you optometrists are like, oh God, that can't be good. Like, I know it. You're looking at it, you're like, oh God, it's painful. But I just want to kind of inform you guys of how those mega volume lashes are applied and how it is safe. So we have a chart that we use for applying lashes. There are times that we can apply 15 little fibers to one natural lash. And that's because the diameter of them are so thin that when you add 15 of them and you apply it to that one natural lash, it ends up being the same weight as one classic lash or less than that. So it just gives that really, really full, scary appearance for optometrists. But they are applied properly, if they are applied properly and the fanning and all that stuff is done properly, then they are technically safe for the lashes. Then you have lash lifts and tints, where those are the perming of the lashes. So essentially what you're doing is you're gluing up these lashes here, and you are adding a perming solution here. It's a thioglycolate acid. And what that does essentially is it breaks down any disulfide bonds in your lashes so that you're able to create a new shape and give lashes that nice look. But then there's tinting involved in that as well. And that's usually where people run into trouble.
What kind of trouble might happen?
So that's where with perming and setting solutions, they almost have like a thicker consistency. So they stay up here pretty good, and you're using a very small amount just along the base of the lash. And you're constantly looking at it and controlling it to make sure that nothing is seeping in. However, the tint itself tends to irritate the client's eyes more. And because of that, their eyes begin to water. And when their eyes water, the tint can leak into their eyes.
Right.
So that is uncomfortable. And if that does happen, and like we teach our students as well to make sure they're standing forward facing in front of them and constantly lifting back on their eyes using micro swabs, like little cotton types of applicators to make sure you're removing it before that happens. And then we have a fan as well. But I think the most important part of the tinting is that making sure people are applying it right and that they're able to troubleshoot it. So if somebody's eyes are watering, put a cotton swab there, take a tissue, prevent it from getting in their eyes.
You mentioned some of the techniques involved with false lashes that can really help minimize irritation and side effects. So talking about individual lashes instead of like a full strip, applying the proper width so it's not too heavy over the natural lashes. Is there a certain rule of thumb that you have on length as far as like what's appropriate for a patient or where you might feel like there would be issues?
So with length and the way that we do that is if somebody wants a longer lash, because there are different styles, people can have short going all the way through and then have spikes. And that's called a wispy look. And they have that. So what we teach students to do is to minimize. So it's like an inverse relationship between the length and the width of the lash. So if you're going to use a longer lash in a certain area, you're going to decrease the diameter of that lash. So the weight ends up being the same. However, with longer lashes, there's that risk of them drooping down and things like that. So you also want to be very careful. I think one of the biggest things with lashes in general and the material that they're made out of, like I said before, with PBT being the plastic that lashes are made out of, they come in different qualities. So sometimes you can have really good quality lashes. Like lashes aren't supposed to be painful. They're not supposed to hurt your eyes. If you felt your patient's lashes and they hurt, they have wrong lashes on. Like you can't, and there's just so many options out there for it, and people don't understand that. But lashes are supposed to feel soft like your natural lashes. And when they're not, it's because they're poor quality, cheap lashes that are essentially going to put you at greater risk, because if you have hard plastic come into your eye, you're looking at having a scratched cornea or more, an eye injury of some sort. So
this is so incredible, because the biggest cons or side effects that I'll see from my patients with false lashes is when they do get too long as a set, it actually almost creates a fan as they blink, and then they'll get all this air misdirected towards their cornea, causing a lot of dryness. There's actually been some studies done. An optical eyelash length is 2/3 the opening of your, we call it palpebral pressure, but the distance between the top eyelid and the bottom eyelid. So if you get an eyelash length longer than that, you actually get that wind tunnel effect. And then the weight, the heaviness that you really kind of touched upon. I have had patients where they actually get vision changes because of the weight of their lashes, pulling the eyelid down, and then that added pressure, they're suddenly getting astigmatism that they didn't have in the past and feel like, oh, I'm no longer seeing well out of my glasses and contact lenses.
So that's from the pressure of the heavy lashes and the longer ones coming down. And that's causing stigmatisms, you said?
In severe cases, it can actually start to misshape their cornea and cause a prescription change.
Right. Okay. So with that being said too, you always, and maybe I should have started with this, is when lash artists, so what we're supposed to do as lash artists is to do a client intake and assessment and liability waiver. And during that point in time, we look at your natural lashes and we'll go through and do a full assessment to say, okay, your lashes are healthy. They are shorter. They are naturally a doll eye shape. You have a little bit of damage here. You have this, but you, as a trainer or as a lash artist, you need to be able to understand that and recognize those areas too. So prior to applying any lash extensions, I go through this full questionnaire. Like I ask about LASIK. Have you had LASIK in the last 6 months? Have you ever had blepharitis? What about glaucoma? Do you have seasonal allergies? Things like that. So that way we can address them first and then determine what's best. So for somebody with short lashes and somebody with thin lashes, I wouldn't go. I'd probably go about 2 millimeters above the eye. You wouldn't go extremely long. And there's so many different styles, but sometimes you have girls that have like 14, 15 millimeter lashes naturally, and they just want even longer lashes. And for somebody like that, then it's safe, but it's totally client based and on the individual itself.
So as part of a normal kind of client intake, you kind of go through the symptoms that might increase their risk, and their medical history that could potentially increase their risk for certain types of procedures. When you physically look at the eye and assess it, what kind of things do you see on people's eyes where you're like, we might have some pros and cons that you can
Right. So I guess with a sty, we won't ever do work with a sty because that is infectious, contagious. So we won't do anything there. If somebody has red eyes, and they're a little bit irritated, we won't do that there either. If somebody has really damaged lashes due to previous procedures, or what is it, trichotillomania, where they pull out their lashes. Those crazy people. And we've had clients that actually come in and pay like $200-300 to get a full set of lashes just to spend the next couple of days picking them out. And I'm like, I can't do your lashes. Appreciate this art.
Awesome. Now, so as part of this procedure, how long after they get their lashes applied, when is a typical follow-up time for your clients?
Usually 3 or 4 weeks. Now, there's some people who, and like the way it works with your shedding too, is I'm sure you guys are familiar with anagen, telogen, catagen lashes. So the telogen lashes are the ones that are going to fall out first. And then you've got your anagen and your catagen, the anagen being the little baby one. So, and everybody's hair growth cycle is completely different. So just as a rule of thumb, I always say, like, does your hair on your head grow fast, etc. We have some clients that won't come back until like 5 weeks because their lashes aren't shedding. You shouldn't be losing eyelashes because they're popping off. You should be losing eyelashes as your natural lashes are growing and falling out.
That makes sense. And at that follow-up visit, what issues sometimes arise that you're seeing where you would troubleshoot or change course?
Yep. So maybe it's poor retention. So for whatever reason, the adhesive didn't stay on properly. The outside corners and inside corners tend to come off quicker. In regards to health issues, the biggest one would be is buildup. So as we know, mites are all over our bodies naturally. It's when they reach a higher concentration, they build up and they cause an infection, which can lead to blepharitis. So when our lash clients are not washing their lashes and they're not taking care of them, then we begin to see the flakes and we begin to see all of these yucky little things going on up here. And that would be the biggest one. Another one, would be that over time, like the more you are exposed to a substance of some sort, the higher your chances are of having an adverse reaction to that. So that's how allergies would build up. So if you're exposing your client to this cyanoacrylate adhesive on a continuous basis, every time they get their lashes done, there's a greater chance that they could end up with an allergy. And one of the biggest mistakes I think that I made, and just being completely out there in the very beginning of lashing without having the proper education like 10 years ago, was having a client who was truly just so addicted to lashes, obsessed with it. And I would try different adhesives on her that didn't contain carbon black or, hypoallergenic. I would try numerous things and she would still come back with really puffy red lids. And I did it a second time, and then I did it a third time. And then on the fourth time, I said, I can't do this anymore. And she said, I'm going to go elsewhere though. And I just had to let her go. I said, I can't do that. I know that this isn't good for you. You're going to end up with a really bad allergy or some other eye condition. So having to, let a client go because of that too but I wish I never had to do it a second time. I wish it was the first time. And then I had to say, nope, go see your optometrist, go.
this is something we all learn sometimes the hard way, where we want to make our patients happy. We want to give them what we want. And then you have to draw that line where it's like, but it's also my job to take the best care of you. But that's a learning curve for us all, where we kind of find out where that line is.
Yep. 100%.
What kind of technology, because a lot of the things you're looking for are obviously the same things that I'm looking for, but I have a slit microscope to give me like 20x magnification to see these things. How are you guys able to see this stuff in this great detail?
So in regards to the actual like eye itself, well, we don't do an assessment on the eye. It's more of a visual assessment, and it's more of us taking their word for it. I mean, we need to be able to, and that's why informed consent is so important in going through those risks with the client. Like if you have thyroid issues, you may not be able to have your lashes last as long because your lashes may come out quicker, because that is a side effect of thyroid issues and also thyroid medication. But we go through the assessment in hopes that they're going to tell us the truth in it. You know, it's not, we can't like zoom in there. And I don't really know if that would be beneficial for us, because applications are done on the eyes themselves. Looking, we're up very, very close. So if somebody has a sty there, we're going to be able to see that, you know?
Absolutely. Yeah. With products to clean the lashes, because I think this is where optometrists sometimes, if they don't put a lot of energy into learning this side of things, may actually advise incorrect products that break down the glue and then cause lashes to fall out, which make our patients extremely unhappy. They may have clean eyelids, but they no longer have the lashes they paid for.
Bye-bye.
What products do you recommend using?
So I recommend using a lash shampoo every day, every second day. And that's something that I was going to suggest to you guys as optometrists, to have those products there for your clients to build up that relationship. You can't prevent them from getting eyelash extensions, even though some of you might want to, but you can't prevent it. So the more open you are, and even having information sheets there. So if you notice that your patient is coming in and you're looking at her eyes and you're being like, she's got a little bit of buildup or that doesn't look right, to have a little sheet there for them. And I mean, I'd be happy to do up something for you to print off there for your clients, but to say, this is what you should be watching out for. Lashes shouldn't hurt. You should be washing your lashes every day or every second day. Don't pick at them. Don't do this. Just like a little list so that they are aware that you're also concerned and that you're being diligent in your area. But the thing that people get confused about, they're like, washing your lashes? What do you mean? Like when you think about it, like the whole purpose of your eyelashes are to prevent debris and things from coming into your eye. Mm-hmm. So if you are then increasing that by 15 times, because with mega volume, it's 15 times more, but even just with, you know, classic lashes, it's still double the amount. You're putting yourself at that much more risk of that buildup there, because you're creating a little place for all that bacteria and those mites to harbor away and create a new little home for them. So if you're washing them, then you're not going to be at risk for that. And then also with adhesives getting hard, when they get hard is when people tend to pick. So if you're washing your adhesive or washing your lashes around that adhesive regularly, then that adhesive isn't going to get hard and clumpy, and it's not going to irritate your eyes or press against your glands or anything like that.
Do you have a go-to product or a product?
Yeah, we have our own products
that you always recommend.
Yeah, so we have Lash Detox right now, and I had spoken with one of the girls from an optometry studio here, and she mentioned to me too, she's like, what about if we sell your products there? And I said that like I'd like to do a little bit more research and like really look at like elastin as an ingredient in it, because elastin is so good for your hair. And obviously where there's minimum studies on eyelash extensions, we have to look at hair studies to relate that to lashes. So I would love to formulate a product for optometrists to recommend and have it, you know, of course, be approved by optometrists too and go through all that process. So I think that's something that we could potentially work on together in the future. But for right now, any lash cleanser that is going to remove any buildup using a brush too. There's like these little, I wish I had some here with me. They're little brushes that it's kind of like just like a makeup brush. and there's soft little bristles on it that'll go right through the lashes.
Yeah.
And what you may notice is if you're recommending that your patients start washing their lashes and they haven't washed their lashes on regular basis, what you're going to see is then their lashes are going to fall out quicker at first because their lashes are not used to that. They're used to getting a little bit more hard. So it'll be like that transition period, but that's why like everything you do continuously and you make it consistent is the most important and most beneficial.
I love it. There's some really great companies out there that my optometry listeners may be familiar with. But We Love Eyes is made by an optometrist in California, Dr. Tanya Gill, and she has a foaming eyelash cleanser that is safe with the lash extensives, and she also retails those brushes.
Yeah, no, that's
able to get in
great.
Home.
And then, of course, anything with just for any viewers that are out there interested in buying products too, I guess you want to look at the ingredients that are in it that are safe for your eyes. You don't want to be using surfactants, which is what you use to clean them. And there are different ones. There are ones that are a little bit stronger, and then there are ones that are like in baby shampoos and things like that. And because your eyes are so sensitive, you just really want to make sure that those ingredients are good ingredients for you and safe ingredients for you.
I'm going to make an official public plea to do not use baby shampoo.
Do not use baby shampoo. Yes, everybody says that. And like, I guess why some people think that that's okay. And there's the whole micellar water, but the way I look at it is it's not just washing your lashes. Like if you're going to be wearing eyelash extensions day after day for 10 years, then you're putting an adhesive on your eyes that regardless of how safe that's applied, there's still an inherent risk and it can still cause damage. So just instead of using a product that's strictly just cleaning it, use a product that is also going to be helpful and have a benefit to your lashes, keeping them nice and moisturized and healthy and not just clean.
That's great. I agree. And when you look at the data on baby shampoo used around the eyelids, it can be pro-inflammatory, causing more redness and more irritation. It can really dry the skin out, and it doesn't have strong antibacterial properties. It's not killing bacteria. So,
right. And the pH, what is the pH of that? I'm just trying to think.
Oh yeah, it's definitely can cause burning and stinging if it gets around the eye, even though it's like supposed to be gentle tearing. If you've ever gotten it in your eye, you know that it's
this is not fun.
Okay.
Also, with the pH of products that you use around your eyes. So I know that baby shampoo has a different pH than we do, which would cause us, it's a little bit more alkaline. Mm-hmm. And for us, we need more acid in our products or acidity in our products. So lower end on the pH spectrum. So by using baby shampoo products that have a higher pH, more alkaline, that's going to cause your skin around your eyes to become flaky and dry. And I just thought of that just then when we were talking, but that is totally going to cause an issue. And then if you have flakes coming into your eyes, you have more buildup there on top of those lashes. So yeah, let's stay away from that.
Another really great product are these hypochlorous acid sprays, which are really strongly antibacterial, kill 99.999% of bacteria and virus. And it's so easy to use. You just close your eye, spritz, air dry. Will not destroy the lashes at all. And so I love that, especially for my patients that have rosacea or frequent styes. And there's a ton of different manufacturers out there that make these hypochlorous acid sprays.
Hypochloric acid spray. So I'll write that down so I can look it up. But yeah, and then like you said, with rosacea too, another part of client intake and assessment is when we ask that, do you have rosacea? Because if you have rosacea, then there's a greater chance of you having blepharitis. So there's a lot of correlations between different medical conditions. And I just have, you want to educate your patients or clients the best that you can and give them that information. So that way, if they come back and there is an issue too, you're like, hey, I informed you of this. You filled out this liability waiver. You are aware. I did nothing wrong here in this sense,
It's good, to equip them with the best tools for success. And rosacea is a tough one. What I found in my practice is many of my patients clearly have rosacea, but do not kind of internally accept that they have it, even though when you look at your face, it's very clear cut. I have low-grade rosacea. It's so common.
I think I do too.
Extremely prevalent. And it can make just kind of chronic redness and irritation around your eyelid margin. If you look at your waterline and it's a little red all the time, rosacea. So almost all of us have it, and it's something that is not a bad thing. It's just our normal genetics expressing themselves.
Like, accept it. Just accept it. We all need to be more accepting of the rosacea.
You probably have it. Okay.
Everybody here has it.
So what can we best do as eye care professionals to support what you guys do when it comes to actual lash procedures?
So I think that while you have your patients there and you're looking at their eyes, and it's so hard not to see their pretty lashes, hopefully, if you notice that any of those lashes, like, they're not supposed to touch the skin. Absolutely not. Cannot touch the skin. And when we talk about age as a factor, I mean, as you get older, you're losing elasticity in your skin. So when you're applying lashes, what's going to happen is the eyelids are going to become a little bit more droopy. So if you're applying it right here as close to the eyelid as possible with keeping a very small distance, though that skin is going to come down a little bit, and it's going to put them at greater risk of having an allergic reaction. So when it comes to clients that are a little bit older, we always recommend that they use tape and to pull up the lids a little tiny bit that way so that the adhesive doesn't come in contact with the skin whatsoever. The other thing too is eye pads, and I see sometimes that people will do eyelash extensions or lash lift and tints with their clients' eyes halfway open. And I'm like, we got to fix that, because then they're just exposed to all of those chemicals over and over and over again. Right. So I think what I'm trying to get at here is for you guys as optometrists is just, be educated on the process, the procedure, and what to look for. Like, this is a no-no. So lashes should always be clean. They shouldn't be painful. If your patient has irritation on her eye, that shouldn't be a thing. Not even a small bit of irritation. You shouldn't feel anything. So you can always recommend to them, if you see something wrong, like a lash up here on the skin, to go and have them removed. And I don't know if you've ever seen lash mites.
Yeah, I mean, well, so in the microscope, we can see the cylindrical dandruff that's classic for Demodex mites. But technically to see the actual Demodex mite, you would need to put it on a slide under a microscope. If you actually see a physical mite, that's probably more like pubic lice. So those are you're not going to actually see a mite crawling on them with your naked eye.
That would be terrible. Pubic lice up there. I wouldn't want to be the one to tell them that. That's for sure.
Yes.
But
when we talk to patients about mites, it can be really scary, but I always try to reassure them, 100% of them, like you mentioned earlier, Dana, we all have mites crawling on our skin at all times. Obviously, they're so small, we do not see them. Those are the kind of mites we're talking about.
Those are the mites we're talking about. But it is, once they do reach, and I have to say that I had a client years ago who was 16 years old, had been getting lashes for 2 years. So started off at 14. She was unaware of any lash shampoo or anything like that. And she came in because she found that her lashes were really, really itchy. And when she came into me, and I do have pictures somewhere here, she had a huge buildup of just debris, like after 2 years of not even getting her lashes wet in the shower. And I could see movement. So from my, no, like, this is how bad, when you say you can't see the lash mites as such, when it reaches an infection like that, you can see movement. So you can see it, and I'm never going to forget that. I had a lot of nightmares afterwards, but I removed them for her, and obviously contaminated. Everything that was contaminated was completely cleaned up and everything. But she was 16, devastated, crying, completely mortified over everything. Her mom came in and was like, "What do we do?" And I was like, if anything, make sure you know where you're going. Go to a reputable place too that's going to give you that information. And I don't know, it's always a good idea for optometrists to kind of know people who are providing those services within that area, because you have a better idea of what that person's like and whether they do care about health and safety standards and things like that.
When you have a patient that comes in with a really great set of lashes that are very well kept, I mean, I love being like, oh, who does your lashes? Yeah. Because that's something we need to be able to pass on.
Yes, absolutely. So building that relationship in the community is great. And like, even just like collaborating, working together with like local lash artists too, and seeing like, hey, if you're doing training, is there anything that we can help you with so that we can teach you the right things to look for if they don't have that education, so that they can inform their patients as well. But yeah, no, I think there's lots of room there for everyone to work together and focus on lashes and eye health.
I loved your comment at the top of the show about 6 months LASIK. That's what I've been utilizing in my practice as a timeline as well. I will tell you guys, I had my recent patient, very successful outcome. Her 1 month post-op.
Yeah.
All she wanted to talk to me about was when she could get her lash lift. And I was like, you need to wait just a little bit longer. Your eyes are healing well, but let's not.
Yeah.
It's still at her 6 month post-op recently, when I was like, all right, I think we can do this now. You're in really good shape.
Love it. It truly is addictive. But we had 3 months down for a while, and then we went back to 6. We had a patient who was adamant about getting her lashes put back on after LASIK, and it was only 30 days. One of the girls at the studio said, if you get your optometrist to write you a letter saying that, I guess that we wouldn't be held responsible, or that she wouldn't be held responsible for it, then she would go ahead and do those lashes. She never ended up doing the lashes, because I was like, I'm not going there. Not going there with it. But what are your thoughts on that? Why would an optometrist say that after 1 month it would be fine?
I think we don't have any training and education about when it's safe. And we're at the end of the day, many people in healthcare, we are people pleasers. We went into this profession because we care for people. We have a strong amount of empathy. And if our patient really wants something, and we don't have the education and training to be able to explain why that's not a great idea, and we don't see anything on the eye that tells us, ooh, that's a really bad idea, we want to empower them to do what they want to do. Right. And so I think it's just coming from a place of unknown, not being aware of the potential cons to doing that, because many times at the 1 month post-op, the patient's seeing well and their eyes are looking pretty darn good. And so it's like, okay, well, maybe you could do it, but like, we've got to be more aware of, okay, what's that going to turn into? Because the eye is still really delicate at that moment in their recovery.
I guess, Jen, my biggest concern with LASIK is like, you have that open wound, and then you're using adhesive that over time does release formaldehyde. And of course, formaldehyde in small concentrations, I mean, it's in our apples, it's everywhere. It's not going to be harmful to us. But when you're looking at it on your eyes and your exposure to that day after day, year after year, like what are those risks? Like, what could happen? I mean, we don't allow our clients to have any contact lenses in, because what if those fumes get trapped underneath? And there's been so many people over the years that came in and be like, I've always been getting them done with contact lenses. And I'm like, okay, well, please don't anymore. And we've actually told people that we can't do their lashes with contact lenses in, which they just think we're completely crazy. But
I think it's good to take those precautions, because unfortunately there is a major shortage of published clinical data to show how much is getting absorbed into the lens. If it's a daily disposable lens that they're throwing away later that day, maybe isn't as big of a deal, but at least 50% of Americans wear a monthly disposable contact lens. Yep. So that lens is going back into the eye multiple days with that repeated exposure, and most certainly could cause irritation. Right. At a 1 month LASIK, the wound is very sealed at that point, but the entire tear cycle and corneal nerve tissue is blown up. When they do LASIK, they create a circular incision, right? Lift that flap up, treat underneath, lay the flap back down. And the flap really is healed in place within about a week. The cornea is incredibly good at recovering, and they're using antibacterial eye drops, anti-inflammatory eye drops during that time. Typically at the 1 month mark, they're done with all of their prescription eye drops. So that's why many people are feeling really good and very happy.
Like, I'm a new woman.
Yeah, their corneal nerves were all severed during the process of creating that incision. And so many of my patients feel fine, but when I look at their eyes, they have dry spots everywhere that they simply cannot feel because their nerves have not regrown into that new tissue. And that recovery for you'd be able to feel when your eyes are dry and uncomfortable, that's usually around the 6 month mark when that feeling is starting to come back. So that's really the risk here is you get a lash procedure done. And most people, if we feel irritation, we know something's not right. I'm going to seek help.
Yep.
You will not be able to feel something's wrong unless it is terribly wrong because you have no sensitivity or reduced sensitivity.
Right.
That's really where the risk is.
Yeah. No, that makes sense. So I was going to ask you another question here about things that you have seen in optometry in terms of lash clients. Have you ever seen anything really bad? Have you ever had any experiences there that maybe you can help educate me on what to say or do in those situations?
I've never had any major trigger. The normal run of the mill, you're not cleaning your lash extensions. There's a lot of buildup on it, but nothing to the effect of the story that you had shared.
Yeah.
And then we've definitely had patients who, especially next day, they'll come in with really red swollen eyes as almost like an acute hypersensitivity either to the glue. And I have had a patient where so swollen and red, I was like, I think we've got to go and get the lash removed. You're having an acute allergic reaction that we're not going to be able to get under control.
And that's another thing is, so I've often gone back and forth with it because when you use a remover on eyes that are already inflamed and already feeling the effects of that adhesive, you're weighing out, do you take it off immediately with the remover? Do you calm the eyes down first, then remove it? And I've always like looked at the individual as such and see like how bad it was, like what was happening. Because obviously if it's still going and going and going and it's not getting better, then you're going to have to remove them. But weighing out when to do the removal and when for them to go and take Benadryl and let it calm down and then do a removal, that's an area that I think, I question sometimes as well.
That's good. As a part of a normal person's expectation when they go in for a first lash procedure, is there skin testing traditionally done just to make sure?
It's not supposed to. So I know in the UK, they do some kind of patch testing. And I've never understood that because you are not supposed to have the adhesive touch your skin. Like I said, it's not supposed to be around your skin. So testing for allergies that way doesn't make sense. If anything, you're just harming that person. You don't want that adhesive on your skin anyways. That's hard to come off. Okay. And also it burns directly through your jeans. So wouldn't be my first choice. But what we do, so if somebody is a little bit hesitant, had a bad incident before, they want to try it out, I'll say, come in and just book a little touch up and we'll do an assessment on you. I'll put lashes on every couple of lashes, like say like 10 lashes on one eye, 10 lashes on the other eye. And then you see how you feel afterwards. And oftentimes I'll do like, if I'm using a black adhesive that contains carbon black, I can do a couple on one eye and then I can do the hypoallergenic. And I say hypoallergenic because it's supposed to be more sensitive, but there's really no hypoallergenic out there. So I try both of them to see what ones would be, what adhesive would be better for them, I guess.
That's awesome. Okay. So those are the kind of things. So here I mean, like so much that you cleared up already, because I was telling my patients that they would probably be getting a skin test done. So now I know that does not happen. Okay.
No, I would never do that. And like, nope, definitely not. And I've gone through, it's so funny. My husband, he's a lawyer. And a few years ago, I was like, can you go look up like a few different cases where like people have been sued? And it's been in the UK, most of them, which was really interesting. Yeah. And a lot of it has to do with patch testing too, people putting it directly on the skin.
Okay. Well, I thought a lot of optometrists learned a lot just in that last minute because we were very misinformed about what happens at Tints.
And again, I don't know, like I'm also in Canada. I've never heard, I deal with a lot of people and we have a trainer that's in the States as well. And patch testing on skin is nothing that I would ever encourage. And I think like any dermatologist would say the exact same thing. Like, let's not do that.
Great. All right, so as they should, first time, they'll probably just be getting a smaller set and seeing as how their eyes react.
Yeah, just like to get like 5 lashes on one eye, because essentially even when you get that full set, nothing's supposed to be touching your skin. And also, I know you mentioned something about strip lashes a little while ago, and like the strip lash glue and eyelash extension procedures are so different from one another. Completely different. There's so much more risk with eyelash extensions, even when it comes to the tools that you're using. I can't tell you how many times I've like cut myself with my tweezers, just walking by and all of a sudden, big job. They are so incredibly sharp. And one time we had somebody here in the hospital that had seen a lash artist, and they had dropped the tweezer in their eye and scratched the cornea, and it was like it went all over Facebook, and I felt so bad for everyone involved. But those are the risks too, so making sure like you are careful with your tweezers, and then there's sanitizing and things like that. It is a very like intrinsic process. It's very detailed, and you really need to know what you're doing and be comfortable with what you're doing. And before I certify anybody, I obviously look and say, am I comfortable with what they're doing? Do I feel like they're going to go out there and do a good job? Are they going to go out there and hurt somebody? If so, no. And I ask them, how do you feel? Are you confident? Do you have questions? How do you think you're going to be? Do you feel comfortable with yourself going out there? And most of the time it's yes, sometimes it's not. And then we work on that a little bit more. But yeah, I think getting to know your community too, for all the optometrists, and finding out who shares similar views that I think I do and you do, and working with them.
Well, I think the amount of scientific education and training that goes into your profession, I mean, if anything from this conversation, if any eye care provider has been listening, I think many of them will be surprised at how much you guys know about the science of what's happening on the eye. We can really work as a true partnership together because you have the same values and same needs for what you want your patient's ocular health to look like that we do. We're speaking all the exact same languages. Yep. And so this is a team that's meant to be, that we just need to build more of the bridges.
Absolutely. I love this. I'm so happy to be chatting with you. And like I said, it's certainly a passion of mine, and I can tell it's a passion of yours. So this has been great. Maybe
one day I too will try this. Based on your description of things, I'm more open-minded than I've ever been.
Yeah, you're going to get some lashes done by me. And maybe what we'll do is, now that travel is open, I've got a few trips planned. Where are you? North Dakota?
North Carolina.
North Carolina. Okay. Maybe we'll come down there someday, and I will do a full lash set on you. We'll record the whole thing. You can ask questions. We'll zoom in. It would be the best.
Y'all make sure you got to check out and support House of Glam Studios. Can you give them the details about where to find you on Instagram and online?
So we are House of Glam Studios _ on Instagram, and then House of Glam Incorporated on Facebook. And if you guys have any questions whatsoever, you can contact me at research@houseofglam.ca. I am always excited to chat about lashes and eye health or anything at all. And I love learning too. So
Dana, thank you so much for your time today. And we learned so much from you. This was a great conversation.
Thank you so much, Jen. And I'm sure I'll be chatting with you in the future.
Absolutely.
Okay.
All right, colleagues, and it's a wrap. Thank you dearly for hanging out with the Defocus Media team. We hope truly something resonated with you. And if it did, be sure to give us 5 stars. And make sure you follow us on all social media platforms. Facebook, Instagram, Twitter, LinkedIn, you named it. And our handle is at Defocus Media on all platforms. And until next time, be sure to keep it 2020. And we look forward to seeing you on the next episode.